Hey Chantel, so I really enjoyed reading your post and I wanted to respond to it because I want to be an occupational therapist in the future and there's quite a few similarities between your future career of physical therapy and mine of OT. So, well, first of all, we will likely work with a very similar patient group and both of our rehabilitation sciences, I guess, are they're both very accessible to diverse populations. So, therefore, we'll definitely need to be versed in similar levels of multicultural competence and intervention strategies. So, first of all, I really liked how you highlighted your belief that discipline, amongst other things, are culturally influenced. I liked that because that off the bat clarified that you already have a decent amount of background knowledge behind cultural diversity and how it can affect families in multiple ways, especially discipline, but many other as well. And then I also really liked how you provided another source by Canino and Algeria, sorry, that stated how important that ethnocultural factors are within the treatment process. um, this was just important because the more sources you have that state helpful information as such, the more relevant your information is. Um, I also incorporated an alternate source from the American Occupational Therapy Association, and this website laid out just how imperative it is for multicultural competence in our fields. Um, the AOTA includes a specific section of their website called the Multicultural Competence Toolkit, and this provides a section about ways to strengthen and broaden cultural competency skills. So they actually have like CEU or continuing education courses um, in cultural competence and in all types of sources and resources occupational therapists, can use to broaden and strengthen their cultural competencies. Um, Also, according to the AOTA, cultural competence is an overall attitude of acceptance, and it is actually one of the most important skills that OTs can utilize. So, because the American Occupational Therapy Association included this portion on their site, I was actually curious if it was the same or if physical therapy had a version as well on the American Physical Therapy Association website, because I know that they both have one. So AOTA is American Occupational Therapy Association and APTA is American Physical Therapy Association. So the APTA, physical therapy, dictates that cultural competence is a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enable that system, agency, or those professionals to work effectively in cross-cultural situations. So it's an elongated version of what the Occupational Therapy Association says as well. Basically, it's very important, and we all need to utilize these skills in order to best help the populations that we'll be working with so that we can provide equal care to all. Um, and since both of these websites that are the association for the whole nation um, state clearly the emphasis on cultural competence, I think that it is quite clear how important it is for us in the future to use these skills to achieve cultural awareness and acceptance, because it is necessary and that is a best practice way we can help our clients and our patients. Um, I also really like how you highlighted the portion about patients feeling like their doctors never listen to them. This is definitely quite an issue in our society today. And actually, I like that you mentioned it because it was discussed in a past research article that we had to read for this course about a week or two ago. It was the Arrested article. And in that article, it indicates in their findings from their study that collaboration between family members can also increase the satisfaction within between practitioner and patient relationships. So, according to Arrestit, they say that if a family member accompanies another patient to their doctor's visits or hospital visits, or in our case, rehabilitation visits, that this will actually strengthen the relationship between the practitioner, you or I or anyone else, and the patient. So, this is quite important as well because this means we can extend an invitation. And you mentioned that allowing your patients to voice their concerns will be very helpful, and I totally agree because if they already don't feel like they're being listened to, allowing them to voice their concerns will definitely be beneficial and helpful, and they will most likely be more willing and understanding that their needs are being heard. But another way that we can probably strengthen our relationship between patient and practitioner would be to invite another family member along in the process. It will probably lead to more feelings of comfort, and according to Arrested, it definitely helps the collaboration piece between two family members because, if, for example, as Arrested noted in the article, perhaps a patient doesn't feel as confident in themselves after they've come to a disease or chronic illness, or in our case, it would be more likely an accident of some sort or something they need rehab for, physical rehab for. And if they lose confidence because of any of these new issues that they have undergone, then another family member being there to comfort them and even speak up for them is quite beneficial. So I really like how you addressed that problem in your post. And then another issue that you discussed that I also discussed was the issue of language barriers. I definitely think that your solutions were valid and they will likely be very useful in reducing the instance of misunderstandings between you and your future patients. Um, I also included that I suggested in my post that I might, when I'm working in the field, try to surround myself with more practitioners who are able to speak multiple languages. Um, your your suggestions are likely much more realistic, but I also definitely felt like that could be a way in which we could diminish some of the issues of language barriers because they are a great problem, and especially in the rehabilitation sciences, um, that is a big deal because people need to be able to communicate their pain and how they're feeling every day. So, best of luck in the future, and thank you.